Hello friends, let's know about pathogenesis. It is an obligate human parasite. The organism enters by respiratory route. The non-capsulated strains of H. influenza are regular commensal in the nasopharynx or oropharynx. Colonization by capsulated strain is found in 5 to 10% cases, of which type B strains are seen in 1 to 5%. Capsulated strains cause invasive infections, type B accounting for most cases. There are some infections that are caused by H. influenza. Let's know briefly about these infections. First is meningitis. This is the most serious disease occurring in children of 2 months to 2 years of age. The fatality rate is about 90% in untreated patients. The bacilli reach the meninges from nasopharynx apparently through the bloodstream. Majority of the cases are due to type B strains. Now let's study about acute epiglottitis. It is the second most common infection caused by H. influenza. This is an acute inflammation of the epiglottis with obstructive laryngeal edema seen in children over 2 years old. This condition is always associated with bacteremia and the organism can be isolated from blood cultures. Now let's study about pneumonia. It typically occurs in infants and is accompanied by empyema and sometimes meningitis as well. While these primary infections are caused by capsulated strains, bronchopneumonia may occur as secondary infection with non-capsulated strains. Now let's study about bronchitis. H. influenza is an important pathogen associated with pneumococci in the acute exacerbation of chronic bronchitis. Now let's study about suppurative lesions. Some of the suppurative lesions include septic arthritis, endocarditis, pericarditis, and otitis media. Now let's know about the laboratory diagnosis. First is specimen. Depending upon the type of lesion, there are some specimens may be collected. First is cerebrospinal fluid. Next is blood, throat swab, sputum, pus, aspirates from joints, middle ears and sinus, etc. Now let's study about collection and transport. Specimens should be collected in sterile containers and under all aseptic conditions. Let's study about collection and transport. Specimens should be collected in sterile containers and under all aseptic conditions. As H. influenza is very sensitive to low temperature, therefore clinical specimens should never be refrigerated. For optimal yield, specimens should be transported to laboratory without delay and inoculated on culture media immediately. Now, direct microscopy. This is gram staining. In meningitis, gram stained smear of CSF shows pleomorphic gram-negative cocobacilli. Immunofluorescence. Now let's study about immunofluorescence and Quellung reaction. These can be employed for direct demonstration of H. influenza after mixing with specific type B antiserum. Now let's study about antigen detection. Type B capsular antigen can also be detected in patient serum, CSF, urine or pus by lactase coagglutination, then counter immunoelectrophoresis. Let's begin with lactase agglutination. Latex particles coated with antibody to type B antigen are mixed with semen. In positive test, agglutination occurs. Now, let's study about coagulation. Coagglutination. Instead of latex particles, Staphylococcus aureus is coated with antibody to type B antigen and mixed with specimen. A positive agglutination occurs. Next is counter immunoelectrophoresis. Specific antiserum is put in one well of agarose gel and specimen is put in other well. Current is passed. In positive test, precipitation line occurs in between the two wells. Now let's study about the culture. CSF culture. CSF should be plated promptly on blood agar or chocolate agar. A stain of Staphylococcus aureus should be streaked across the blood agar plate on which the specimen has already been inoculated. Plates are then incubated at 35 to 37 degrees centigrade aerobically with 5 to 10% carbon dioxide overnight. The isolate is then identified by its colony morphology, satellitism, gram staining and serotyping. Now, let's study about blood culture. It is usually positive in cases of epiglottitis and pneumonia. Now, let's study about sputum culture. Sputum should be homogenized by treatment with pancreatine or by shaking with sterile water and glass beads for 15 to 30 minutes. Several samples of the sputum are to be cultured to increase the rate of isolation. Now let's study about the colony morphology and staining. After overnight incubation, small opaque colonies appear that show satellitism. A smear is made from colony and stained with gram stain. It shows small gram-negative bacilli or cocobacilli. Now let's study about serotyping. Typing may be done with type-specific antisera. Now let's study about the treatment. H. influenza is susceptible to sulfonamides, chloramphenicol, trimethoprim, ampicillin, tetracycline, ciprofloxacin, cefuroxime, cefotaxime and ceftazidime. Cefotaxime or ceftazidime is the drug of choice for the treatment of Hemophilus meningitis. Beta-lactamase bearing strains have acquired resistance to ampicillin.